earlier, I think I'm one of those examples of initially all I wanted to do was medical dermatology. I knew how to do cosmetic dermatology because I had training in it, but it was never my full passion. I did an extra year in cutaneous T-cell lymphoma, learning for a fellowship post-residency, so after residency. And that was all exciting. And I didn't realize until I went into the real world in private practice, where I started solo, where you kind of need to be able to pivot as a business owner. When reimbursement was a little difficult to come through as a new practitioner because it takes time for you to credential, establish your reputation. It seems like actually the knowledge that I gained in cosmetic dermatology became very useful. A lot of the patients that I had been treating too eventually started asking about cosmetic treatments as soon as you get their medical concerns under control and you're able to get them to clearance. They too have a well-rounded target as to like their skin condition needs to improve, but also then they would want other aesthetic needs to be answered as well. And by then, a provider would have already gained the trust that you built and the rapport you built with your patients, that the trust is there. They don't want to go to another facility to get their cosmetic needs answered. And so I think it just all made sense. It all kind of like fell into place, fell into my lap a little bit after I was able to clear a lot of medical concerns for my patients. So I think companies like Aerolase that have devices that kind of bridge that similar need for patients became very appealing to me. So aesthetic services oftentimes too is a more practical thing to invest in, especially in private practice, because then you take away that third party that has control sometimes over how it's being reimbursed, what you can offer to the patient. So cosmetics, a lot of it is in your hand, and however smart you can be in terms of offering the patient something affordable, but yet meeting that goal that they want to see. So I think having an offer on both ends of the medical and cosmetic practice, I think only makes a practice more wholesome.